My name is Devin Mormon. I'm a physical therapist here at Loudoun Sports Therapy Center, and today I'm going to go over a little more information about a common diagnosis that we see here that you may have heard of called plantar fasciitis. What exactly is plantar fasciitis? Plantar fasciitis has to do with the bottom of the foot. There is a piece of thick material at the bottom of the foot, and what happens is you start having pain there, and more specifically more at the heel where that actual piece of tissue connects. What does the plantar fascia do? What's its job? So that piece of material on the bottom of your foot is responsible for shock absorption. As far as anything that you do on your feet, it provides that ability to provide relief at the bottom of the foot and absorb whatever impact you're doing. Also, it helps support your arch in your foot, that inside medial arch of your foot, and provides it some support there as well. What kinds of symptoms do you have with plantar fasciitis? Well, the most common symptom is waking up in the morning, first thing, putting that foot down and having pain, most likely in the heel, like I said, where that fascia inserts. It can travel along the actual foot into the plantar surface where the rest of the tissue is, but the most common thing is when you put that heel down on the floor, you get pain immediately. You'll take a few steps, it'll seem to get a little bit better, but those symptoms can then return more so the more time you spend on your feet, or if you're doing high impact exercises. What makes you at risk for actually getting plantar fasciitis? As far as ages, it ranges usually the most common between the ages of 40 and 60. Also putting you at risk is having really flat feet as well as really high arches because of the way your foot kind of turns. When you either have a flat foot, your feet are kind of pushed down like this, which is called pronated. When you have very high arches, you're turned very high up this way, which is called supinated, and that puts different tensions on that material on the bottom of the foot and can aggravate it over time. The other thing is, unfortunately, obesity. So if you are having a lot of weight issues and you're gaining weight, that's putting a lot of stress on the bottom of the feet when you're standing up, walking, all those things, and it can flare that up. Another thing for at risk is if you have a job where you're on your feet for a really long time, several hours, maybe on a hard surface, that can also irritate your feet as well and cause that plantar fascia to act up. In addition, even ballet dancers can also be at risk just because of the mechanics of having to do ballet with that very pointed toe. It shortens the plantar fascia on the bottom of the foot, which makes it very tight. So that can also put you at risk. What other things can you do to actually handle this? How can you handle this problem? What you need to do is take note as to where your pain is and how long you've had it for. It's a lot easier to take care of it when it's first starting as opposed to waiting until it becomes more chronic, which is usually into the 5 to 6 month category. If left untreated, what happens is it starts now inhibiting your normal daily activities. So instead of just bothering you at work or exercise like that, it can actually start to cause you trouble going up and down stairs, walking in your home, not even long distances, being able to stand to make dinner at night. It can cause all issues with all those simple activities. Another thing is the more that this persists and goes on and left untreated is other things can happen above the source of the pain. So your feet hurt, you start walking differently and not addressing the issue, that can throw off your knees, then that can throw off your hips, and then even into the part where you start having back pain because your feet are not you're not utilizing those muscles correctly in the foot and ankle, and things are getting so tight that you're altering the way that you walk, so therefore other things are going to start to hurt. So how can PT actually help you with this? So what PTs can do is we can evaluate where your limitations are. We can also give you exercises, a lot of stretching exercises. We can talk to you about other aids that can help you during this time, such as night splints, which keep your foot in a flexed this way position, so that actually stretches your calf which inserts to your heel as well via the Achilles tendon, that big thick tendon in the back of your ankle. What also we can do is we can also give you some information about better shoes that fit your feet better to accommodate whether you are flat-footed or whether you have high arches. Also, we can give you some ideas about inserts into your shoes and where to get them, and what inserts would be best to fit your foot's needs. And also, we can teach you different things on how to progress. So if you go too fast too soon, once you're feeling good, you're automatically going to think, hey, I'm awesome, I'm going to be doing well, I'm going to go back to running, or I'm going to go back to this. Usually that's the time there it's most dangerous, because you're just starting to feel good, you think you've got it under control, but we can actually guide you through that process to make sure that you do not re-injure it and it doesn't start bothering you all over again. Ideally, the best form of treatment for this is conservative, and which is physical therapy. We will get our hands on you, we will do some soft tissue work to the bottom of your foot as well as your calf if it's really tight, and then also teach you things you can do at home. If you have any questions or concerns, or you're still kind of on the fence about whether this is a problem that you are having, feel free to give us a call at the number below, and we will be happy to answer any of your questions and get you in for a more comprehensive evaluation.